Hey there, welcome to the Thriving in Wellness podcast with Haley and Caitlin. This podcast is for women who are tired of just surviving and ready to truly thrive. It's time to reclaim your health and build trust in your body.
Join us as we mythbust nutrition topics, tackle your mindset, and dive into the nerdy side of women's health. Just a reminder that this is meant for educational purposes only and is not meant to be used for medical diagnosis or treatment. Now let's jump in.
Hello and welcome back to the Thriving in Wellness podcast. I am here with two awesome guests and we're going to talk all about oral health today because we know how important that is for our overall health, our gut health, everything. So I'm here with Ashley and Dr. T, and we are going to dig into some really interesting things that I'm excited to hear more about their take and their experience with. So I'd love for you guys to introduce yourselves, tell us a little bit more about how you got into this field and how your practice maybe differs a little bit from traditional dentistry. Whoever wants to go first.
You can go first.
Okay. Hi, I'm Dr. T, short for Dr. Tinoco. I tell my patients T for tooth, and it kind of gets me that dad joke in, kind of lightens the mood a little bit because it's not always a favorite setting for people. But I've been practicing now on the Central Coast since 2016, which seems like a longer time than I'm willing to admit. And Ash and I have been managing a practice in Los Osos together for about 5 years, and then decided to open up Rooted Dental Wellness and Untethered in Gopher Beach 3 years ago, almost to the date. We just celebrated our 3-year anniversary on the 12th.
Congrats.
So it's been a lot of things to be grateful for there. But short story is really, initially I thought I was going to go to medical school, and I was actually studying for my entrance exams. And I went to go shadow dentistry because I needed somebody who spoke Spanish. So I ended up spending the day there, and I just found it really empowering to be able to help people in the moment with my hands versus the prescription, like something I could physically do to have some kind of positive change on someone's life. And fast forward years through education, dentistry just felt kind of boring. And it felt like I was doing the same thing over and over, and there was no change in what we were doing. And then started to notice some tendencies about how people would breathe and jaw development and function, and how those patients tended to have more oral issues. So Ash and I were just like, there's got to be a better way of doing this. And there is.
Yeah, well, I'm excited to dive more into that with you guys today. So thanks for sharing that. Ashley, I'd love to hear a little bit more about your story.
Yeah. So I've been in dentistry since 2012. Even back in 2007, through 10, I did a little bit of dentistry as well before I went to school, but started out in the field of dental hygiene, so preventative dental care. And through starting Rooted Dental Wellness with Dr. T, we found a big need for restoring function, and a big part of function is doing things such as oral myofunctional therapy, which is the rehabilitation of the muscles of the face and jaw and swallow. So things like physical therapy for the neck up. And so I've been doing that with Dr. T over at Rooted Dental and over where I'm at today, which is our practice next door, Untethered, which is an oral myofunctional therapy and airway center. So yeah, the way I look at like how Dr. T and I have the practice together is I'm kind of the one looking at the new patient through the eyes of prevention. And then I have Dr. T come in and I give him the big lowdown of what we found in the preventative exam. And then he's looking at not just is there teeth we need to restore because of dental disease, but why is that happening? And how can we also make sure that that's being treated so that we're not just playing whack-a-mole with people's teeth and oral health.
Yeah, well, I know I can relate to so much of that in the nutrition world too. Like Dr. T, what you were saying, like you feel like you're just doing the same thing over and over again, the same sort of conditions are showing up, and we're just following the same protocol versus actually asking the question of why is this happening? What can we do to prevent it? And I know I was a patient of you guys when you were over in Los Osos. I totally would be now if I didn't live like an hour and a half away. But,
fair enough.
So I'm really excited to dive into this. So anything else that you want to add before we kind of jump into some of the questions?
I don't think so.
Okay. I'll say what I'm gathering from you though is that, and I know just from talking to you, Ashley, working with you in other settings and being your patient, you definitely are different from most conventional dentists. So I'd love to hear kind of what your thoughts are on, or maybe differentiating a little bit more about what you do versus conventional dentistry, and what are some of the, I guess, issues or concerns you see in the conventional traditional dentistry world.
Yeah. I think to like umbrella term each of them, and maybe Dr. T, you can go into examples of each one, but that's something we talked about a lot when we wanted to make Rooted Dental Wellness, is if we're going to go and make a practice, we've got to do it differently. And how can we do dentistry differently? And the three things we found is dentistry is very reactive, retractive, and random are the three R's of which traditional dentistry is. Duck, do you want to talk about like how it's reactive?
Yeah, but the reactive part, might be one of the things that we get taught more in dental education, which is just focused on treating side effects. Like when I'm going in there and I'm saying there's a dental cavity going on, that's a side effect of the environment of the mouth. It's not a primary disease. And that's why it gets very whack-a-mole with dentistry. And that's why it can get kind of disheartening as a practitioner and as a patient to have continued issues and continued to have to treat the same tooth and things like this versus treating the root cause. And I don't necessarily think that all that issue isn't just all with dentistry. It also a lot comes of it with dental insurance companies, because dental insurance companies reimburse on specific codes and specific treatments. So they're the ones dictating this tooth needs this treatment, instead of being like, oh, well, why don't we just treat the root cause of this situation or these other treatments kind of thing. So these insurance companies pick what needs to be treated, and then dental schools follow and teach dental students to treat this way. And then you go out to private practice and then you practice this way, but it's not really, your dentist making that decision. They are, but it's like so rooted in the education and the insurance system of it all. So I think that part of the reactiveness is like, I'm already treating something when there's already a problem. Like, how does that entirely make sense for people's health?
Versus being truly proactive and preventative.
And for the retractive piece, I think of this almost every day over here at Untethered as I'm working on getting someone's tongue posture and things like that to be aligned, is that we start a lot later than we should when we're talking about jaw development and milestones we're looking for in children. And a lot of dentistry is focusing on the teenage years when we're doing braces. But the problem at that point is the jaw is done growing around 11. So doing braces on a teenager is a little bit also reactive, but how it becomes retractive is they usually pull teeth, and then we retract the size of the mandible and the maxilla, and it just shrinks and kind of becomes smaller. And then you're pretty much forced at that point to have to do things reactively because the tongue doesn't fit in the jaw. So the patient's hard to do dental surgeries on or get fillings with. So you're kind of playing whack-a-mole. So it just kind of dominoes into this like really long trajectory of what dentistry will look like for them, instead of just focusing on earlier interventions and getting the jaw to be nice and wide and then the teeth come in straight. There's really just no need for braces or orthodontia when the jaws are aligned and when the jaws are wide enough to accommodate the teeth that we're born to have,
Yeah. And I think that just the whole medical field, in my opinion, it might be who I surround myself with, but I feel like we are progressing. We're recognizing that something needs to change. And so a lot of this stuff that you guys are talking about, again, it might just be what I read online and the research that I'm putting myself into, but it seems like a lot more is coming known about this. And we recognize that a change needs to happen, that we need to address some of these issues.
Yeah. One of those is happening right now in dentistry. Dr. T and I are excited about, which is kind of falls into the whole category of like dentistry being a little random, in which it's really like the only medical field I know of where we do things randomly, like without testing. So bacterial testing is becoming more common in dentistry, and I hope will be part of the standard of care one
Oh,
day. We
interesting.
hope to make it part of our new patient appointments as well, so we know exactly what we're treating. And then sleep studies is something we've already been doing for a few years to make sure that when we see grinding and clenching of the teeth, and when we see a tongue that isn't cooperating the way we'd like, or really low soft palate muscles, that we're not just throwing a night guard in there or recommending, I mean, we don't, but other practices might recommend like Botox for the masseter muscles or jaw to like stop the symptoms. But really that's just a Band-Aid if there's sleep disordered breathing going on. So doing sleep studies to see, okay, is the root cause of these symptoms something that we can address? So trying to move in the path of making things less random and less guessing work before we're opening up a tooth or asking a patient to spend a lot of money on something like a night guard, making sure that testing is done beforehand and not just an exam and x-rays.
Yeah, that's so interesting. That's never something I really thought of, like the typical, just exam, x-rays. I don't know, that's what I grew up doing, right? I was very fortunate to not need braces, and I've had pretty good like teeth, no major issues, which is fantastic. My husband is a whole nother story. But with the testing, like with the bacterial testing, it sounds like this is very new, but is that kind of like just a swab that you do? Or because I know I do gut testing, and Caitlin and I, my co-host, we are really big into doing testing. So we do hormonal testing, blood tests, and GI map. And we like that can be life-changing for a lot of people to understand what's going on before, like you said, just kind of randomly saying like everything's fine, or we're just going to put this Band-Aid on it. So that testing that you had mentioned, is it something that you foresee coming standard practice?
Yeah, it's a saliva test. It's pretty cost effective for the patient. I think a lot of offices could even just include it in their new patient exam. It's not, that economically unfeasible. I think that how I see it changing things, and where I've recently had a paradigm shift about it, because at first Dr. T and I talked about it years ago when it started coming kind of trendy. It was kind of something trending in the dental community. And it kind of seemed like at first just another way to like have a patient spend more money on something they didn't need. So we weren't really into it because we didn't see how it really changed our treatment plan. When we're seeing dental disease, like it doesn't really matter what bacteria is there, the treatment's going to be about the same most of the time.
Yeah.
But where we really see it changing disease is in a preventative way. So a patient that we see is healthy, maybe that's the person actually who should be do bacterial testing to see what pathogens are starting to grow and kind of take over the oral microbiome, and how can they do things proactively before we see symptoms of disease. Because by the time we see cavities, by the time we see bone loss, by the time we see gum disease, like you can't regrow bone, you can't regrow gums, you can't regrow tooth. So at that point, we're kind of still being a little reactive as well. So I think that it has the potential to change how we treat patients who present asymptomatic, just like you would get blood work done at the doctor's, even if you feel good at your primary care yearly visit and you're like, yeah, I'm good. They're still going to run like a basic, panel CBC and look at what's going on. So I think that may be how we see bacterial testing coming into dentistry.
Yeah, that's interesting. I'm curious. I know this isn't something you guys use often now, but with like in the gut, obviously that's what I'm focused on more so. Like there's certain protocols that I follow, whether it's like we need to follow a killing protocol because there's overgrowth or there's really low beneficial bacteria. So there's certain protocols that we follow. What would be some strategies? Is it like certain mouthwashes, or like what sort of things do you do to help prevent the overgrowth of some of those opportunistic bacteria in that situation for the oral microbiome? I know this wasn't a question we planned, but I'm very curious, like what would be the approach if you are starting to use that?
I feel like I'm talking a lot.
Your hygiene background?
Oh, sure. I was just going to say, like, at our practice, we have ozone, we have oral probiotics. We're not really big on mouth rinses, but I suppose depending on the test results we get back, there's a time and the place. One example I'll give is a patient we had, we'll call her Jay. She presented with one of the most severe periodontal cases Dr. T and I have seen in our practice. Because keep in mind, being in functional and holistic dentistry, we tend to attract a certain type of patient, and usually they're pretty healthy.
Yeah.
We've probably
People who
seen
want to
this
be
in regular
proactive.
practice. Yeah.
Right,
Um,
right.
And we had a couple hygienists come in and take a look in the room. We thought maybe the patient had something autoimmune going on. I think we sent her out actually for some regular lab work, and we thought she had a necrotizing gum situation as maybe an infection of HIV. So like, it was a serious enough case. We did all this kind of like, oh my gosh, what's going on with the systemic health, and set her up with a nutritionist as well. And basically, long story short, everything was like fine systemically. And we did bacterial testing, and actually everything was fine bacterially. And one thing the test does not test for is fungi.
Oh,
And
interesting.
so we kind of just on a whim, actually read an article, and it kind of reminded us. I read an article, and it was a really interesting kind of fungal case that just responded to regular. I think you prescribed nystatin, Dr. T.
Yeah.
And it was like night and day difference. So we were like, oh, that was actually pretty simple. And if we had done bacterial testing before we even like saw her, right, just as like an entrance to our, our practice, I think at that time, I think we would have maybe got to avoid the patient some unnecessary, moving around. And she had already done a lot of that, because a lot of other practices were just like, you need gum disease treatment. Here's the treatment. Oh, it's not working. You need it again. And she had gotten it treated 4 or 5 times with the same treatment, just playing whack-a-mole. It wasn't working. So
let's just go harder.
Let's just keep doing it. So I think that's one person that stood out to me. And then it makes me think, I hope one day that the saliva testing we do is not just for bacterial stuff, but includes more viral stuff and fungal stuff, because it can be, from
there's so much that could be going on. I
was going to say, like, the laser that we use specifically targets like viral capsid. So if it's a viral buildup that you're having, like Epstein-Barr virus or hepatic lesion that's causing breakdown of the gums and the collagen, all that stuff, then laser treatment's going to need to be a part of that. If not, you're not going to get the same kind of results, versus if you're getting a bacteria that's anaerobic and doesn't like oxygen, then the ozone that we use in the practice is going to be a lot more effective with that, because it doesn't want air, right? So then your treatment is more tailored specifically to the patient's like oral biome and what's growing in there, versus just being like, you need gum treatment, and then it doesn't respond, and you're like, wait, is there something systemic going on? But it could just be the pathogen or the whatever bugs are in the mouth.
So the testing helps you not have to guess as much, basically, and hopefully have a little bit more streamlined approach.
And it helps the patient not spend as much money, because I think the only other way to do it would be to hit all options in a treatment recommendation. So like doing the ozone and the laser and the non-surgical gum therapy and the airflow procedure and like all these add-ons. I think that bacterial testing has the potential to also limit what we actually end up doing, and then retesting, seeing if it works, and then adapting your treatment plan accordingly.
Well, I'm excited to see how that comes to play for you guys, and just in the world of dentistry. That's really interesting. I'm hopeful, like across the board in the medical field, we're going to be testing a lot more, because I see kind of what you were alluding to, Ashley, is like, we don't want to just test something unless it's actually going to be effective and change the treatment. But I do see it's like, people are either completely against testing and they're like, it's pointless, we never need to do it, it's just a waste of money. And then the other end of the spectrum, people swing, they're just like testing everything. And I kind of see that a lot, unfortunately, in the functional world, and people are spending like thousands of dollars on these testing. So definitely making sure it's something that's going to give you some guidance. And obviously you never know for sure, like with that patient that you mentioned, but it can be a helpful stepping stone for sure. So I think this is a good time to kind of transition. And I know a lot of your clientele are probably on top of their oral health and everything. That's why they're seeking you out. But what's one thing that you wish people knew or did on a regular basis to support their overall oral health?
We kind of had a thing to take away and not do that a lot of people do, and that's mouthwash. We're very opposed to a daily mouthwash. There are like marketed and branded like more holistic or better mouthwashes that have like essential oils and things like this. But most essential oils, the concentration's too strong for healthy bacteria in the mouth. It's kind of like putting an antibiotic in your mouth and you kind of disrupt the whole oral biome. So you're taking out healthy and unhealthy bacteria. Um, there are cases where we recommend a mouth rinse, but it's usually following gum therapy, and it's usually for a short window of time, and it's usually like a liposomal vitamin C that actually helps like give nutrition to the gums locally. So the mouthwash, I think, is one of the big ones that tends to replace some other oral hygiene stuff. Like they'll do mouthwash, but like won't floss kind of situation because things feel clean, because you've kind of just erased a lot of things that were in there. But mouthwash would be a good one to get rid of. And oral hygiene is actually a lot simpler than we make it out to be. I think a lot of times you're trying to go up and do like oil pulling and these other stuff, which can be good and can have its place, but nothing replaces brushing your teeth with hydroxyapatite for 2 minutes and flossing. It can be as simple and as sound as that. Yeah. Unless we're having jaw development, airway issues, and then we're talking about oral myofunctional therapy and needing to mouth tape and things like that. Yeah.
Yeah.
But for most cases, simpler is better.
Okay. Well, I have more questions on that for sure,
Yeah.
but I kind of a personal question because I feel like I've
Yeah.
been on the hunt for a good toothpaste. Is
Okay.
there like a one brand that you guys tend to recommend just as like a general healthier toothpaste?
Yeah, we've been really fond of the toothpaste FIG. It's an acronym that stands
Interesting.
for Future Good Guys. I
Okay.
really like both the creators of the toothpaste. Their intention with ingredients is really a big reason of why we chose them and why we carry their toothpaste in our office. It's really clean. It's going to be the cleanest toothpaste you can find that is also effective.
Yeah, that's the key.
There's a lot of holistic toothpaste out there that you spend $10 or $12 on, and I like read the ingredients and roll my eyes. I'm like, this does nothing except maybe strip your oral biome with all these essential oils and charcoal and all this stuff. But
Yeah.
I went through
yeah,
a
so
charcoal
I like
phase.
their toothpaste. Yeah.
Yeah.
We all been there. We all been there for sure.
Yeah.
But I really agree with Dr. T. I think, in any field, but especially right now, the holistic field, I remind my patients that just how they come in here with these big ideas of what Western medicine is or what big pharma is doing and, controversy within that. I try to remind them like the holistic field is right behind them in terms of marketing. And we're being marketed a lot of stuff, and my patients are on a daily basis that they just literally don't need, and that don't have a lot of evidence to back up the claims that are being made. And I agree with Dr. T. We're like literally brushing and flossing really is as simple as you need to make it. And if someone's doing both of those things well and regularly, then we can talk about if they want to really up their game and do like an oral probiotic or mouth taping. But what I fear in the holistic dental space is really getting caught up with a lot of those extra things when we don't even have like the basics down. Just like in nutrition, if somebody's not drinking water, it's like, we're not going to talk about a big supplement routine. You know what I mean?
Yeah. Like people will come to me and they want to do all this testing and they're like not eating till 4 p.m. in the afternoon, wondering why they have no energy. I'm like, okay, let's take a step back.
Yeah.
Right.
Yeah. You've mentioned mouth breathing and mouth taping a couple times, so I'd love to hear. That's something that I haven't been doing it recently, honestly, but I was doing for a little while and I noticed a big difference. So I'd love to hear kind of your thoughts on that and when you do recommend that, or if it's just kind of across the board, something that you think is a good thing.
Good question. I don't think it's a good thing across the board. I actually kind of have feelings when I see stuff on social media with certain people like everyone mouth tape. I'm like, oh my God, don't do it, people. They have to be able to functionally nasal breathe. And about 30% of my clients cannot do that. They either have serious congestion issues, deviated septums, enlarged turbinates, tonsil issues, nasal valve collapse. So many reasons why people have to breathe through the mouth. And not that I condone it, but the fix is not going to be mouth tape. They're going to just end up getting anxiety and so at some point in their sleep taking the tape off because they're choking, which is not going to create a good result. And then they're not going to trust me or they're not going
Yes.
to trust whoever they read that from. And then the relationship is over. So I think, and this is a big reason why our new patient exam is 2 hours. People like 2 hours, that's so long. I'm like, sometimes it's not long enough. Like there's so many things to look for, so that if a patient calls in and is like, hey, can I mouth tape? I can just go to their chart and see if we covered their ability to functionally nasal breathe. Did they pass a 3-minute breath test? Did they have signs of nasal valve collapse? Because we check for that with our loops on in patients and do a screening and see if they need to go see an ears, nose, and throat doctor. So I think that there's a time and place for it, and it's amazing if a patient can tolerate it. Yes.
So another question on that then, does someone have to go through some sort of exam like that to know that they can functionally nasal breathe? Or is there something they can tell like at home or just based on how well they breathe through their nose that they're like, okay, maybe it's safe for me to try this?
I think if they can put mouth tape over their mouth while they're awake for 3 minutes,
Mm-hmm.
and maybe even put a little water in their mouth to see what's going on if they feel the urge to either swallow or spit out the water, I think that's a good sign. And Dr. T evaluates and screens our patients for nasal valve collapse. Do you want to show them a little trick they can do for at home for that?
Are you talking about silent mammoth, or are you just talking about sticks?
Neither. I would just like how you screen, like when you put your chin up in the air and
gotcha.
Yeah, my nostrils come out. Yeah.
Yeah. So you
you
just do a
had nasal
screening
valve
for the
collapse,
nasal.
and he got it
Yes, and I had the
31 minutes ago.
procedure done. So I've been a mouth
letting you be the
breather
spokesperson.
for 31 years. I got it when the procedure when I was 31. I'm 33 now.
Can we pause real quick? Because I don't
yeah.
even know what this is. So what's nasal?
Okay.
We said nasal valve collapse.
Now it's nasal valve collapse. That's
okay. So what is
can be
that?
one of the reasons that people are not a habitual nose breather, and instead they transition to mouth breathing. So I usually have patients look up and tilt their chin up, and I have them take in a regular breath of air, not trying to like suck in all the air, but just a normal breath, because that's not how we're breathing at night, right? So something to mimic that. And what I'm looking for is collapse of the cartilage. And what will happen is that as you're breathing in, you would think that your nose would dilate, get bigger, that space would open up for air. But some people's actually collapse and get smaller or narrower or thinner. And so there's cartilage that's collapsing that pathway for the air to get into the nose and get the nitric oxide that you need, humidify and warm the air, all that kind of good stuff, and put you into rest and digest nervous system and relax you. So that nasal valve collapse is an easy thing to evaluate for. There are Band-Aids for that, like silent mammoth, which is like a nasal dilator that goes into the nose and just opens that up. And sometimes we use that as a testing tool. Be like, try this for a week, see if you're able to breathe and sleep better. And then there's an ENT we work with specifically in Santa Barbara that does amazing work. And they do a nasal valve collapse procedure, which I had done. And it's about a 90-minute procedure. You go in and they put an implant where the cartilage collapse. That implant degrades over time, and the scar tissue actually keeps that space open. It's like keeping a doorway open, and then you're able to nasally breathe. Right. So then I've been able to transition from being a habitual mouth breather to a nasal breather. And that specifically was my issue versus not having enough tongue space or being tongue tethered or something like this. Yes. So if I had gone in for an appointment and wasn't screened and was told to mouth tape, I wouldn't be able to. Right. And I would find that very alarming advice. Right. Because I feel like I'm suffocating at night. But we screen for that. And yeah, it's been a really life-changing experience to be able to switch from mouth breathing to nasal breathing.
Yeah. I know for me, like I never fortunately seem to really have a major issue with it, but I've just been really congested recently with like the wind and the dust and everything. And I've definitely felt a difference with having to mouth breathe quite a lot more than I normally do. So actually, I'm going to move on because I think we could talk a lot about this. You guys are a wealth of knowledge for all of this. I wanted to touch a little bit on the tongue tie. And so Ashley, I think this might be more something that you would want to answer, but of course, Dr. T, feel free. But how do you notice? Because I mean, I don't have any kids, but I hear tongue tie often a lot more when in babies and when they're having issues with like breastfeeding. We don't talk a lot about it as adults. And so I'm curious if that's not something that's caught as a child or if it's something that can impact you later on in life. Just talking a little bit more about that.
Yeah. Well, the reason that we hear about it a lot in babies is because babies have really simple yet really complex milestones to achieve. And if they're not being achieved, there's somebody noticing and they bring it up to somebody. So if a baby is not feeding, if they are not latching correctly, if they're not latching at all, if they're having struggles on breastfeeding or bottle feeding, they're going to get the kid checked out and get the kid assessed.
Yeah.
Either one or two things will happen. They'll be diagnosed with a tongue tie, or they will be told that the tongue tie is fine, and they're taught how to compensate. So maybe they work with a practitioner who uses a nipple shield or things like that that bring the child through feeding fine. And then we have this misconception that the tongue tie is not an issue, when really in reality the tongue tie is not an issue for feeding, and you were able to help the baby compensate through something. But there's other milestones that the tongue tie will affect, such as the next one will be delayed speech, or speech impediments, bedwetting, behavioral issues, via
Interesting.
lack of oxygen. If the tongue is choking the baby at sleep, they're going to have a lack of oxygen and have sleep disordered breathing. And symptoms of that are going to be behavioral issues, bedwetting past the age of 4 or 5. And then it becomes facial changes. They get longer in the face. The white sclera under the eyes start to show. They start to lack mid-face development. And then they need braces. And then as an adult, they need a CPAP is pretty much how the trajectory goes. So I guess how it impacts adults, I'd say the main one is sleep, because we all know how important sleep is. And for those of us that sleep well, one couple times a year when we don't sleep that well, the next day we feel that change in our mental health. We're grumpy, we're more anxious, more depressed, whatever. So somebody who's dealing with oxygen loss every night, whether that's on a micro level, a moderate level, or severe level, will have symptoms to their everyday life, mostly impacted by their lack of sleep quality. So I would say
so
sleep.
Interesting. Yeah, that's huge. Sorry, go ahead.
The other thing I was going to say that people don't talk about a lot, even in my own field, that I wish people talk about more, is actually gut issues. So if somebody has a really low tongue posture and it's because they're tongue tied, or even if they're not tongue tied and they have a low tongue posture for some other oral myofunctional disorder, nasal issue, tonsils, things like that, they will swallow dysfunctionally. And when we swallow dysfunctionally, we swallow a lot of air. And how that contributes to the gut biome and dysfunction is pretty huge. I have a doctor who refers me patients who have been unresponsive to their SIBO treatment, and to see if they have a swallowing issue. And every single person they've sent me already, I think there's been 4, each of them has had a tongue thrust, swallowing excessive air. So like the treatments they're trying to do with gut are not going to work when you're just
more of a physical issue versus like an environmental issue. That's really interesting. And I see so many people that struggle with their sleep, and a lot of people just kind of brush it off. Like that's how they've been. They don't think it's a big issue, but I know you guys know like that impacts every aspect of your health if you're not getting adequate sleep or good quality sleep. So one more question about the tongue tie then. Is there a way that adults could know if they have a tongue tie? Would it just be going in for some sort of evaluation? Like say they do struggle with their sleep and that's something they've struggled with for a long time, or they do have reoccurring SIBO. What would be the next step that you encourage?
The next step would be getting assessed by a tongue tie release provider, or an oral myofunctional therapist, or even a physical therapist, or a speech language pathologist, as long as they were specialized in tethered oral tissues. I would say if their website does not say, hey, I'm trained in tethered oral tissues, often abbreviated as TOTS, like TOTS, and they don't use the word airway or function on their website, I would say find another provider. You can be assessed online pretty easily because it's about function. So it's not really about what the tongue looks like. And that's some of the problem when patients come in, they're like, oh, my dentist has never brought this up. I'm like, well, have they spent an hour and a half looking at your tongue function and done a sleep study? And they're like, no. I'm like, okay, then they just looked at something, which once in a while is right. Sometimes I get a referral from a dentist who's like, but it's usually at that point really, really severe. There can be people who look not tongue-tied, they can stick their tongue out fine. They can even maybe touch their tongue to the tip of the nose, but it's about how the tongue elevates. So it's a shift of mindset of realizing there's really nothing we have to do in life besides eating an ice cream cone and oral intimacy where our tongue is outside of our mouth. Everything else important, swallowing, sleep, that's with our tongue inside our mouth and elevated. So it's really more about how the tongue elevates and if it can suction like this.
Mm-hmm.
Okay. And this is I have a tongue tether as well. I'm working on expanding my jaw so I can be a good candidate for my friend here, Dr. T, to laser that up for me. So, but the point is that the tongue needs to be able to suction. And I'd say the other point is that it needs to be looked at in a functional way. Like I don't care what it looks like. It can look really, really tethered. And I see those and I get super excited. And then they're functioning pretty well. And I'm like, oh, okay. And then there's someone like mine who doesn't look that tethered, but there's a lot of functional things that are an issue. Like I can't reach my back tooth to like clean my tooth, like I can't
I'm like
reach
totally
it
trying to
after I
test all
eat,
this stuff as you talk through it.
So yeah, there's a lot of like little function things we have to look at. And then you have to assess, is putting a patient through oral myofunctional therapy and a tongue tie release going to make those issues better? And is it going to offer them a quality of life change? Because not every tongue tie needs to be surgically released. There's non-surgical things and body work you can do to strengthen the tongue and loosen the fascia. So it's a lot more complex than just like looking at it. You know what I mean?
Yeah.
Like,
yeah.
It's
I
a
would say
good
most
hour and a half
people-
decision-making process.
Yeah. And I'd say a fair amount of people aren't good candidates for like a functional tongue tie release. Because when we're talking about tongue function, the tongue suctioning to the roof of the mouth, that's what grows your jaw. That slight pressure is what grows to your jaw. So functionally, you can't get it in there, then your jaw is smaller, which makes your airway smaller because that's what's right behind there if you push back on your jawbone, yeah. And then if you combine that with like retrognathic ortho, a lot of the times they're taking out 4 bicuspids. It's like the same 4 teeth that they take out. And statistically, every tooth you have missing, you have a 5% increase of sleep disorder breathing. Right. So if you just took out 4 teeth, that's 20%. So on those patients, if you rehabilitate them and get them to have proper tongue function, they usually have tongue spillage, meaning when they suction up there, their tongue spills over the chewing surfaces of their teeth. So
I'll show you
so if you release their tongue, there's not enough space. Where's the tongue going to go? Right. Which can make things worse. It can go to the back of the throat and make sleep disorder breathing issues worse, which is why we always take a 3D image. And this is why we're also doing expansion and actual, not like, I think expansion, sometimes that word gets like a negative connotation. People think it's like something and you're twisting and it's a really painful experience and all that stuff. But the appliance we use is a stem cell based appliance, and you use it in the evening and while you sleep. And it's biomimetic, meaning it mimics your natural growth pattern, meaning actually rehabilitates your tongue posture so your tongue can rest up at the roof of the mouth. That activates slight vibration on the appliance that activates the stem cells in your teeth ligaments to actually grow your jaw bigger. And it's mainly used in the evening and nighttime because that's when growth stimulating hormone is secreted. So like moving stuff during the day isn't advantageous because you're not in the right nervous system for it.
Yeah.
Right? So there's like a lot of factors that go into that situation. So just because your tongue tethered and you're non-functional doesn't mean you're a good candidate for surgery, right? And some patients with just oral myofunctional therapy are able to improve their sleep and get to a place where they don't need surgery, right? Or we make them an appliance that's a CPAP alternative, that actually moves your bottom jaw, your mandible forward and opens up your airway, right? So it just depends on the severity and the time investment the patient is also willing to make, because we're not offering like a pill to make your jaw bigger. The expansion process is like a 2-year process. Physical therapy with Ashley is usually 12 sessions, right? So it's not a
one and done,
take this, kind of thing. It does require work and effort and consistency.
which not everyone is willing to do, but there are a lot of people out there who recognize all the benefits and they're willing to put in that time and effort, commitment. You mentioned the tongue placement a couple times, and Caitlin and I were talking about this because I've heard that, and it sounds like this is kind of the way you guys lean. But I'm curious what your thoughts are on this, because I've heard that ideally, like just sitting throughout the day, our tongue should be kind of suctioned to the top of the mouth, and that helps put us in more of like a calmer nervous system state, like the rest and digest. But I recently had a therapist say that that actually makes you more stressed and you should push it down. So I was just curious what your thoughts are on like tongue placement throughout the day. Okay.
No.
Nodding your head, shaking your head.
No.
Please expand.
No. Low tongue tone. No, you don't want that at all. In Unless you're running through a jungle and a cat's chasing you, or you're doing an intense workout where your mouth's gonna open and you need that extra oxygen, fine. But for your day to day,
ideally,
you can have Ashley, the
mouth.
therapist. She's probably passionate about this one more. I just want to be like, no,
I mean,
definitely
this is
not.
a simple answer because I hear things like this all the time. This is my theory because there's no evidence. There's not even bad evidence to show that keeping our tongue low is where it should go. My theory, this is total theory, is whoever says these things has a very narrow maxilla. Okay.
Oh,
When they smile, you're going to see a bunch of gum. These people have a really
I'm a gummer. My husband calls me a gummer.
Okay. They have a hard time putting their tongue to palate. So for them, when they put it low, they're like, this feels more comfortable. Let me tell my patients that. Let me now tell people that that's the way it should be. It's like anecdotal. Okay. That's my only theory, because I've had a patient say this a couple times, and then I'm like, who is this person? And I try to figure it out, and I'm like,
well, she sent me like an article and everything. So I don't know. I was like,
send it to me, but I've never seen any evidence, even bad evidence or like bad studies that show that the tongue goes on the bottom. Because when we breastfeed, like if you think of like when we're born, we're obligate nasal breathers and our tongue is suctioned to the roof of our mouth. If you open the mouth of a baby, their tongue is suctioned unless they're tethered or have other airway issues, but the tongue's natural position just anatomically is suctioned to the roof of the mouth.
Yeah.
And if it's low, not only will there be airway symptoms, but you'll shift your teeth as well. That's how crooked, pushing on the teeth and all that start. Yeah. But yeah, definitely send me the article because it'd be interesting.
And I should clarify, it wasn't like a real article, it was more like a handout thing. So someone could have totally just made it up. But I will send it over.
But I mean, there's probably like some studies that are going to show certain breathing techniques like breath of fire and things like that calm you down, and your tongue can't be suctioned for that. So there's going to be times, but I mean, like where the tongue should live posturally, just like if I'm like stressed in my back, going like this might feel good, but
you don't want to live like
this all day. That's not going to be good. And that's maybe where this tongue thing is coming to, is like with certain breathing techniques or therapeutically to relax some part of the body, maybe putting the tongue down can assist in that. But where it should live subconsciously throughout the day and night would need to be on the top of your mouth, or you'll choke on your tongue. If your tongue's low while you sleep,
interesting.
You're gonna choke on your tongue. Yeah.
I was just gonna say physiologically it makes sense for it to be at the roof of the mouth too, because it's creating like a suction seal. So if you imagine breathing in through your nose and your tongue's down, now the air has an opening from going from into your nose into your mouth space. I don't have lungs in my mouth space, right? I want that air to continue to come down, right? So not as much of a benefit from a physio standpoint to have that. And then if you have low tongue tone, it's easier for you to be a mouth breather because your mouth is going to want to drop open. And then if that habit starts building in, a lot of people get oral diseases from the mouth breathing because the mouth dries out the mouth, and then you get very acidic bacteria. And then my example for it is like, especially if you mouth breathe at night, it's like having Coca-Cola in your mouth all night, right? It's just sitting on your gum lines, and you get cavities in certain patterns of areas that are incredibly difficult to reach for the dentist to access, incredibly difficult for the patient to let me access. The fillings don't last long because you're getting cavities in areas where you ideally shouldn't get cavities, right? And then patients who have like a non-functional time build these habits, they tend to dislike dental treatment more than other patients because it often feels like they're choking or can't breathe, right? Because they're always mouth breathing, not nasal breathing. So when I lean you back and I'm working on the back corner of a bottom molar, like that procedure is close to impossible, right? And how long is that filling going to last, and how good is it going to be? Not very good. It's going to be replaced. So yeah, it's difficult.
Yeah, interesting. I guess this is another personal question. Ashley, you brought up a lot of gum when you smile. Could that be a sign of anything?
Yeah, so when the gum is overexposed when you're smiling, the top jaw, the maxilla, has kind of dropped down and has been deficient in growth. So the bottom mandible kind of gets stuck. So those patients are a little higher risk for upper airway resistance syndrome or sleep disordered breathing via a more narrow palate that's encroaching on the nasal space and growth when you were developing, or via the mandible, the bottom jaw, being a little bit more protruded when you're sleeping. Do you have anything to add to that, Doc, from a jaw growth perspective?
For the tongue and the jaw growth?
For gummy smiles, like what are they at more risk?
Yeah, it's from a dental perspective, it collapses something called your vertical dimension of occlusion. So you have the two jaws this way. You want to have a certain space that's like up and down, right? But if the upper jaw maxilla is like overexposed, it came down very more. So it makes dental procedures difficult. So what I mean by this is like the spacing between your teeth hitting is important. Some people, like, let's say you need a dental crown and I'm working on a bottom molar. Well, if that upper jaw is down more, I have to remove more of your tooth to make sure there's enough thickness for the dental crown, which means there's a higher risk of having post-op pain, higher risk of hitting the nerve and needing a root canal. And that crown is going to be easier for it to pop off, you know? So like the patient's like, I got a crown, it pops off all the time. Sometimes that's an environmental thing, right? So, you know, we tell people like this tooth's going to be really small if you want to treat it, and we give them a heads up beforehand. But that's something I'm looking at when I'm doing surgery. I'm like, when I work on this tooth, I'm going to have to like over reduce it, meaning I'm going to have to take away more to be able to treat it. And bite might feel off and the bite might feel high and things like this. So that's what I mainly see from a dental perspective. And then cosmetics as well. It's a little bit harder to hide like cosmetic veneers or like crowns on front teeth. There's more display versus if you have like a lower lip line and you smile and you can't see the crowns as well, that tends to kind of aid in some difficulty of cases.
Very interesting. Like I said, I could probably talk to you guys for hours about this. So it's super interesting. If you guys are listening, there was a lot of visuals on this, so I highly recommend checking out the YouTube video. So you could see them kind of walking through some of these steps. And it sounds like I need to come in for an evaluation. But if you guys are on the Central Coast of California, I would definitely recommend giving them, like reaching out to them, seeing if they can help you out with anything. It's Rooted Well Dental, right? In Grover Beach. So we will include all their contact information, everything in the show notes, but I wanted to see if there's any last takeaways or anything else that you want to share with our audience today.
I don't think so. I think we covered a lot. Yeah, do you have anything, Dr. T?
I'm just going to say two things. One is if you get evaluated for a tongue tether and they ask you to stick your tongue out and then they say yes or no, you don't have a tongue tie, that is not the place to be. And secondly, I would say that when we talk about functional tongue tie releases and that procedure, it's a lot more minimally invasive than people think. If you go on Instagram or social media and look at it, people usually have these triangular, really large reductions of the tissue underneath there and things like that. That is not the way I do them or was helped out by Dr. Zaghi and the Breathe Institute. So I think there's also, with those procedures, since they're not as regular as getting a dental filling, there's a lot of like unknown to it. And I'd say it's probably a simpler procedure for most patients compared to like a dental filling.
Interesting. Yeah, because I had just watched, there's a dietitian that I followed that went through a whole tongue release and everything, and it seemed like it was very invasive, very prolonged recovery and everything. So that's interesting to hear.
Yeah, you want to make sure you're doing it with a practitioner that uses laser, a CO2 laser, and isn't doing a scalpel and things like this. Yeah, it's not about the amount of tissue you remove, it's about removing specific tissue fibers that are affecting the function. And so like when we do a release, Ashley's in the room, an oral myofunctional therapist. We usually have like a cranial sacral therapist in the room as well. So it's not about making it like a certain size or shape, but it's about improving the function of the tongue. Yeah.
Yeah. Very interesting. Well, thank you so much for coming on. We'll probably have to have you guys on again in the future to talk even more about this stuff, because I'm sure there's
Sure,
more
yeah.
that'll come out. And once that testing evolves a little bit more, that'd be really interesting to hear about that too. So thanks again. And I will talk to everyone later next week.